By now, you've seen lots of images from Bellevue Hospital, where a man with Ebola, Dr. Craig Spencer, is being isolated and being nursed, hopefully back to health. But I bet you have not seen this. What's on the other side of the cameras? Rows and rows of camera crews and reporters and TV live trucks, all covering an invisible disease that, as far as we know today, has only infected one man in this city of 8 million. It is news because it's new. After all, you can't spell news without new. But this morning, we will examine how the media has responded to this latest Ebola case and whether we, the public, are being well served. Two experts, two doctors, are about to join me here in the studio. But first, a very telling statistic. If you're sitting at home right now, kind of uninterested in the latest news about Ebola, maybe thinking about changing the channel, I've got some news for you. You are in the minority. Take a look at this Pew Research Center data. It's from October 16th through 19th. It shows that 49% of Americans are following news about Ebola very closely. Another 32% say they're following the news at least fairly closely. That totals more than 70%. Pew says this is one of the 10 most closely followed news stories of the past 4 years, ranking up there with the killing of Osama bin Laden and Hurricane Sandy. So how should experts communicate about Ebola in a way that's reassuring and not in a way that just spreads fear? If people are paying such close attention, this is a critical question. So let's bring in Dr. Alexander Van Tulleken. He's an expert in tropical diseases at Fordham University and now a CNN medical analyst. Thank you for being here.
Thanks for having me.
I wanted to have you on the program this morning because I was sitting at home watching CNN Thursday night. You were on with Anderson Cooper when the news broke about this confirmed case of Ebola in New York, and you were being so careful, reassuring viewers about it. You said you live about 5 blocks from where this man was living, and that you felt perfectly safe going home, taking an Uber, taxi home, going to the bar nearby. Was that purposeful language for you to try to reassure the public?
Yeah, I mean, I think it wasn't so much a conscious choice. It was prompted by a question, and clearly my proximity to him and the fact that I'm not concerned at all about this. But we have a real difficulty reassuring people about Ebola because we have two conflicting stories. And the first is...
Mixed messages?
Exactly. Well, the science is contradictory, right? On the one hand, Thomas Eric Duncan, the first patient in America who got it, the index case, his family stayed with him when he was symptomatic in his house, exposed to bodily fluids for several days and did not catch Ebola. So we have proof that it's hard to catch. We've had other people, Patrick Sawyer, flying to Nigeria, the American who brought Ebola to Nigeria, infected 11 people once he got off the plane, but on the plane, symptomatic, didn't infect anyone else. So again, proof it's hard to catch. And yet, doctors and nurses wearing protective gear catch this disease seemingly quite easily. So we have this incredible contradiction, and it's very hard to explain to the public the difference between contagious, how easy it is to catch, and infectious, how likely you are to get it if you do get a droplet of bodily fluids in your mouth. It's highly infectious, it's not very contagious. Difficult message.
I hear you saying that it is not, when you see the television coverage, when you read the online coverage, you are not seeing an overreaction on the part of the press. Instead, maybe what you're seeing is an attempt to explain something really complicated.
I think so, and I think there's this really delicate balance to strike where I think the press has done, in this particular crisis, a really great job of doing what the Fourth Estate is meant to do, keeping an eye on the authorities.
Holding the government accountable.
Exactly, and the CDC did not do a good job in Atlanta, was very poorly prepared, and the government itself has been incredibly slow to react to the international crisis, which is what's driving the cases in the US. But in doing that, of course, the constant streaming of Ebola
wall-to-wall coverage.
Exactly. It makes people very nervous. If it's news, it must be dangerous. Why else would we be hearing about it?
It sounds like a case where the medium is the message.
Exactly.
Simply by covering it all the time, there's a message people receive that it is dangerous, even if it is not dangerous to them personally.
I think that's right. And the analysis, the next step that you'd really want from this story is to say, what should we worry about? And the answer is we shouldn't be worried about Ebola, but we should be worried about other diseases. What we have is evidence that the CDC and the authorities don't protect us well from diseases or as well as they should. So Ebola is easy to control. And Sanjay Gupta's been great. He keeps saying this is bread and butter stuff they can do in the hospitals. This is putting on gowns. You know, it's not that complicated to do. But flu, that's going to kill thousands of Americans this year. That's what we should worry about.
Am I right to think, though, that it's hard to tell people what to be worried about? Risk is meaningless to people.
I think that's such an interesting idea that's probably the most common question that gets asked in the Ebola epidemic is, should we worry? And the answer is, I have no idea. It depends on what you want to worry about. It depends on what worrying means to you. It's an emotional response. I can't tell you how to feel. But what I would say is the thing people should be doing is a cost-benefit analysis. The cost of, for instance, restricting air travel versus the benefit. I think the benefit is almost nothing and the cost is massive. And everyone thinks, no, the cost will just be on the West African nations, don't have to worry about that. If we restrict air travel to them, they restrict air travel to us. Rwandans are already saying Americans got to be streamed when they come in, and that's a big problem.
Thank you for being here.
Thanks very much.
Of all the reactions to the latest Ebola case, this tweet stood out to me the most. It was from the keyboard of Arthur Caplan, the well-respected director of the Division of Medical Ethics at NYU's Langone Medical Center. NYC Ebola patient went bowling, but remember, he was not infectious. So media, stop scaring people. Bowling may be more dangerous than he was. Well, let's see what he has to say this morning. He's here in studio with me. Thanks for being here.
Thanks for having me.
Bowling more dangerous than Ebola? Come on.
Well, I suspect it is. When that guy was at the bowling alley, he was not symptomatic. He did not have vomiting and wasn't excreting bodily fluids. He wasn't infectious. And I know we're all going to run around saying maybe he brushed up against someone. The only way you're going to get Ebola from him in a bowling alley is if you have sex with him or share your toothbrush with him there. I suspect you could drop a bowling ball on your foot, and I'll imagine somebody must have slipped and fallen and cracked their arm in a bowling alley, so I'll stand by it.
You're getting to this idea that we are afraid of the wrong things as a society. It feels like right now we've gone from scary story to scary story to scary story.
Yeah.
I can think back to ISIS this summer, or maybe even the missing Malaysian jetliner in the spring. It's not that those stories aren't scary. Is it that we shouldn't personally fear what they're about?
And I don't think we should overestimate the risk. I mean, Ebola is new. It came out of Africa. Who ever heard of it? Now we're wondering what this sort of out-of-control epidemic in Africa is going to do to us. I'm not saying you shouldn't pay attention, and it's reasonable to want to be cautious. But look, let's compare it to something else that comes from other places in the world. The flu. Every year it shows up, it kills 5,000 to 20,000 people. Do we freak out?
But this is what Alexander was just saying about how people aren't able to really judge risk very well. We're not wired that way.
Let me give you an example of risk judgment that the media shapes in a funny way. You've all seen that Ebola virus graphic.
Yes.
I think people think it's 3 feet long and it must be like a tapeworm. It's, you know, a tiny little microscopic thing, but the whole imagery of Ebola, gear, suits, giant worm-like thing. I mean, you know, you couldn't do better if you were trying to produce a Hollywood movie to scare people than the way this sort of comes across.
So everybody wants to be the head of a network. Let's make you the head of a network for a moment. What would you be doing differently today?
I'd say 2 things. One, let's keep our reporting to the sort of facts of Ebola. We don't have to sort of give the warnings to people to look out for this and that. They are going to naturally do it. 2, let's keep it to the guests who have something constructive to say. It's great to come on and say, holy cow, I don't know, should we quarantine this guy? What do you think? I'm not sure. Well, come up with something positive. Give us some suggestions. If you're going to be a talking head, then be a constructive talking head.
That's an interesting point. Professor Caplan, thanks for being here.
My pleasure.